It's before 8 is the time. We'll come back to your views concerning the National Health Service and the plans that were laid out in the House of Commons yesterday. But to help pick up on some of the points you made, let's welcome to the conversation Conservative MP and Health Minister Ed Argar, who joins me now. Noting that we heard from the Secretary of State yesterday that sadly the waiting lists on the NHS won't start to fall until March 2024, not eliminated until a year after that. What exactly are we getting for our £12 billion per annum? Good morning.
Morning, Nick. Nice to see you.
Good to see you.
We've been very honest, and the Health Secretary has been very honest about this, about the impact on the waiting list that both the pandemic has had already. We've seen them go up from 4 million to 6 million, and potentially another 8.5 million people who would normally have come forward who didn't. That's why we're being realistic about the trajectories and the ability to bring these waiting lists down, and we're honest they will go up before they come down. What we're getting for this money before it shifts to social care, as was set out 2 years on, where it shifts into funding social care, are more diagnostic centres, more capacity in the NHS. We continue to support, and I think you had on your programme earlier someone from Unison talking about the healthcare workforce. We continue to grow and support that workforce. What we will see is that by July of this year, we should see no people waiting more than 2 years. Now, that's still a hugely long time to wait, but there are, I think, around 18,000 people at the moment waiting more than 2 years. We want to get that eliminated swiftly this year, and then we want to start seeing that waiting list properly coming down overall by 2024, with 1 year waiters eliminated, anyone over 1 year, by 2025. That's a long trajectory, but it's a realistic one, and I think it's important we're open with people about that.
Okay, well, as we're being open, I appreciate that waiting now is at some 6+ million, but it was at 4.5 million before the pandemic. So the department was incompetent then. It's just become more incompetent, hasn't it?
As you saw during the 2019 election, Nick, one of the key priorities the then new Prime Minister set out was tackling those waiting lists, more investment. One of the first pieces of legislation passed after the Brexit Act was a piece of legislation I took through, which was increasing NHS funding by 33.9 billion by 2023-24. But crucially, and what we do need to do, what we needed to do then and what we must do now in the light of the pandemic, is ensure that it's not just about inputs, about money, it's about outputs, and that we reform the NHS and look at new ways of working, many of which we've learnt during the pandemic. There haven't been many things in this pandemic that we would say were positives, but there are new ways of working we've seen, and we need to make sure reform goes hand in hand to bring down not only that extra 2 million, any more that may join, but also that original waiting list, which you quite rightly say was there beforehand.
And I appreciate the pandemic has arrived, but what would you say to a listener who's in pain with a bad knee, or his mum or her mum is in pain with a bad knee or a hernia or whatever? They've got to wait even longer, and they're going to have the NI hike. How do you justify that?
Well, there's a number of points there, Nick. Firstly, as you would expect, in bringing these lists down, we've set those clear targets about 2 year waits, 1 year waits, and getting the long waiters down, as well as bringing the overall waiting list down. You're absolutely right to highlight there are millions of people out there who will either be in pain and needing treatment, or anxious, waiting for a test result, not knowing whether they will need treatment. Around 75% of those on the waiting list are not people in need of treatment or surgery. They're people waiting for other procedures, or in the large part tests. Those people will be very anxious. So as well as those who are in pain, I also think it's important we remember the mental health impacts and the anxiety impacts of those waiting. That's why we've got this plan and why we've put it in place. That's also why, as part of this plan, there's 4 key elements. The fourth one, key element there, is My Plan to Care. It's about better information. It's about better support while people are waiting, to keep them informed of waiting times, giving them more choice, but also supporting them. And that's something that a lot of the organisations we've worked with on this, campaigning groups, patients groups like Independent Age, have called for, to support people while they're waiting.
You referenced my conversation with someone from one of the trade unions, Unison. There are, I understand, 93,000 vacancies currently within the NHS. Why is the figure so high? Why are people not attracted to this profession?
Well, there are a whole range of factors, and it shows not only do I read my newspapers before coming on your show, I listen to your show before I come on it.
Good to hear.
As well. We've taken steps. You're absolutely right to highlight that historic level of vacancies. We have seen since 2010 a very significant increase in healthcare professionals in the NHS, 30,000 or so more doctors, 38,000 more nurses. Just last year, 2020 to 2021, we saw nurses go up by 11,000, doctors by 5,000. What we need to do, though, is not just recruit, which we're doing, and we're growing that workforce, but as your previous caller, your previous guest said, we've got to look to retention as well. Now, that's partly about pay and conditions. It's partly about getting those extra staff in to share the workload around more. It's also about more flexibility. So in looking at retention, we're looking at how we can be more flexible in how nursing staff and other clinical staff work to better fit their lifestyles and their work-life balance as well. So it's about choice for them as well.
Isn't this shortage of staff just another casualty of Brexit? You're aware of how many people left, how many Europeans left the National Health Service, are you, between 2016 and 2019?
Well, what I've seen, Nick, is that the reduction, you're right to say, it was mainly in nursing, if I recall.
22,600 European nationals left the National Health Service post-Brexit, 2016 to 2019, 8,800 of whom were nurses. So that's one of the impacts of Brexit, isn't it? It denuded the National Health Service. Well, actually,
the important point here, Nick, is if you look at the NHS recruitment in the round, you're right to highlight that in some areas we've seen some leaving. We've also seen an increase in recruitment and people joining the NHS from other countries outside of the EU. And I'm doing this from memory. I think it's a net positive overall in terms of people coming in compared to people leaving the NHS. So I think we've got to be a little bit careful about looking at it.
But we could do with those 22,600 staff now, couldn't we? EU nationals who decided to. This is another result of Brexit, is it not?
No, I don't think it is, Nick. I have to say, and I don't often disagree with you, but on this I do. I think a factor of this, and you're looking at some of these figures, a significant chunk of those people also was over the past couple of years. There were a large number of people who will have gone home during the pandemic, either to support the healthcare system in their own country, or because they wanted to go home and see their families. But we have seen changes in the past few years as well, and that's a factor. And we've also seen EU citizens continuing to want to work in this country, coupled with the additional workforce we're seeing coming in from other non-EU countries. So it's a more complex picture, I think, than simply that, Nick.
Jamie from Leicestershire asks, could you ask the Minister, what have 11 years of a Conservative government done for waiting lists? I might add the line, just seen them increase, haven't they, Minister?
Well, what you've seen is
11 years, not you, but your mob have been in power, and it's gone backwards.
Nick, I didn't dispute when you first raised it. I didn't dispute that there were 4 million, just over 4 million on the waiting list before. I think it was about 2.5 in 2010. So I'm not disputing that. I come on your show. I'll always try to answer your questions in a straight fashion. We've seen a huge increase in that, and we will see more increases as a result of the pandemic. 1 in 9 people on the waiting list. In Wales, it's 1 in 5, and they still haven't published a plan for tackling it. We have published a plan with record investment, both for the elective recovery, but also that 33.9 billion, alongside a social care reform plan published last September, alongside increased staff in our NHS, and the commission that the Secretary of State gave to Health Education England and NHS England for that 10-year strategy for workforce as well.
Last minute or so together, reminding my listeners you served as Justice Minister. What should the punishment be for a football player who decides to kick his cat round the front room?
Well, look, I think we've all seen that horrific video. There is no place for such for abhorrent violence against animals, for animal cruelty in this country. We have some of the strongest welfare standards in this country, and we've been clamping down on animal cruelty. I won't comment on an individual case specifically. That's for the authorities. I would expect them to look at this, and I would expect the police to look at this. But what I would make is
Were you surprised he was picked last night, Mr. Argar, by West Ham?
Well, I know your football knowledge is always greater than mine, and I suspect
it's not a hard one. He was picked to play. I would argue he should have been.
West Ham match more carefully than me, I suspect. But look, that's a decision for his manager and his team. I'm not going to get into the details of a specific case, but I would expect the authorities to consider that very carefully. I'll come back to my point. There is no place in any context for animal cruelty in this country.
OK. How many of your staff are back behind their desks in the Department of Health?
In my office, I was in there yesterday morning on my floor. All of the desks outside my office were occupied. One of the things I would say, and I think I know where you're going with this, Nick, is that the NHS and DHSC have massively expanded their workforce beyond what was normally planned for, accommodated in the London offices as a result of the pandemic. That office is full. We're looking at how we can move more staff out and come up with a more flexible routine with staff working from the office but in regional hubs and elsewhere around the country. That's a work in progress. That's a reflection of the pandemic and the huge number of extra staff we recruited in a very short space of time.
Grateful as ever for your time. Thank you. Health Minister Ed Argar appearing here on LBC. 1 minute after 8 news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation.